Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones with Synergy Broadcast, and as always, I want to welcome our guest, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the Patient Education Specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she is also the author of the book, No Time to Teach, The Essence of Patient and Family Education for Healthcare Providers. Great little book, and we'll tell you all about how to get it later. We typically use Fran's book for a lot of the topics that we're going to talk about, but this episode is going to air in October, which is Health Literacy Month, and so we thought we would spend some time talking about health literacy today, Fran. We've also talked about this in 3 other episodes, episode 5, 13, and 32, and even after discussing it 3 times, the problem still exists out there. So we just got to do a better job in this episode.
We'll work on it.
Okay. Now, the biggest problem that we have has to do with patients not understanding. Research from last year says patients only understand 50% of what their doctor discusses with them. 60% of patients do not understand information they're given either about an upcoming treatment or procedure. And in another study, patients forgot 80% of what they were told, and 50% of those who remembered anything got it wrong. So what this tells me as part of the unwashed masses out there is that you can't say something once and expect the patient to understand it. You know, you're going to have some who are going to get it and they're going to be fine. But you're not going to be able to get everybody to do that. So the absolute key, in my opinion, to patient health literacy and patient understanding is to do one thing. And we derive that from your book, and that's to focus on the patient from the get-go, from admission. So why don't you kind of take it from there and talk a little bit about why this is so important.
Well, I think it's easy to think that if someone is educated, they will understand the health issue and understand you if you say it one time. But we really shouldn't assume that, because health literacy is more than just literacy. It's not just can you read, but it's also, do you understand how the body works? Do you understand about diseases? Do you understand how things move from one person to another? I mean, it's really a lot more complex than just literacy. And then can you take information that we give you and apply it to your life and change your health behavior so that you don't have the same problem over again? So it's very complex. So we really need to focus on assessment and what the patient is understanding. So by asking first, what is it they understand about the underlying problem, you not only get a sense of what actually do they understand, but also by the word choices and the complexity of their answer, you can get a sense of how well they understand it and how you should best present the information so it's consistent with what they know already.
Yeah, and what they know also encompasses what they feel, what they may think about what they know, whether or not they believe what they know, and also they're going to get a lot of input from other sources because somebody saw something on the internet or they read an article or this. So all this stuff is going to be rumbling around in their head, and the crux of the whole thing is you've got to get to the heart of what they believe quickly in order to even know what to provide them to get them to the point of where, and I'll use your term, where they're functionally health literate, which means by the time they leave the hospital, can they take care of themselves?
Yeah, I mean, one example that I could think of right away is a friend who was diagnosed with cancer. And her first response was she doesn't want chemotherapy because chemo it kills you. It kills, and you have to deal with that belief, that understanding, before you can move on and talk about treatments. So it's very important to assess the learner.
Yeah, and you don't assess just one time either. You do it once to begin the foundation, but you have to keep doing it over time to see if the patient is really grabbing onto what you're telling them. You have to spoon feed them. You know the old joke, how do you eat an elephant? One bite at a time.
Right.
Well, I think the same thing is appropriate here. You cannot feed the patient everything they need to know in one 3-minute or 11-minute or 15-minute session. It just won't work. And so you spoon feed over time and let it build up, and you have to keep checking. It's kind of like checking the oil in your car. You got to make sure by checking the dipstick if there's stuff in there, if there's oil in there. So the same thing is true, I think, with patient education. You got to keep checking. And what are some of the ways that you do that?
Well, it's always good to just ask, well, tell me what you know about this. Mm-hmm. But then after you've done some teaching and you could ask things like, what do you remember? What do you want to know now? What part isn't clear? Mm-hmm. And just work with what they know and build on that slowly. Reinforce what they get correct and fix understandings when they misunderstand or they misinterpret things.
Yeah.
Based on how they got it at that first time.
Yeah, and one of my favorite questions that you have that you didn't mention is, how would you explain this to your husband or a family member or a friend? Because then they have to use their own words, and that really helps you get to the crux of whether or not they get it.
And they will be explaining it to other people, so it's a very valid question.
Yeah, and it's also possible for, as they explain that to other people, if they don't have a good grounding of it, it's easy for someone to say something that'll make them suddenly begin to change their thought. Because I've seen that happen with my wife, who's been a diabetic for, well over 15 years. And she will sometimes, when she checks her blood sugar in the morning and it's high, she will say, well, I only ate so-and-so before I went to dinner, so this just can't be right. And I have to remind her, well, you have a pancreas, and it has an impact on what you do, and other things have an impact. It's not just about what you ate, so you can't just make that blanket statement that you ate this. Well, so-and-so said this, and I said, but that's not what the doctor says. The doctor is adamant and told you not to worry about the higher readings in the morning because of what your body chemistry does while you're sleeping.
Yeah, it's a fluid process. You really have to keep on top of it.
Yeah, and so it's always changing, and so it's incumbent upon the patient educator to make sure. And I know this is hard when you go from one patient to another over and over again, but if you use assessment every time you are talking with a different patient, it helps kind of what's the word I'm looking for? Helps bring back into focus the issues that the patient has and reminds you where you need to go, because you don't always have the option to look at the chart and fully understand it every time you're in front of the patient, because there's other things that the nurse has to do, right?
Yeah, it's also bringing it up to date for now.
Yeah.
It's always going to be changing. I mean, lots of things can interfere with memory and understanding, so you really have to work with what is there now so that when you continue to teach and teach more, you will be building on what their understanding already is.
Yeah. And so I think perhaps we can summarize that the absolute key to patient health literacy and patient understanding is to focus on the patient and do it from the beginning and do it throughout their hospital stay, and even beyond that if you're still involved with the case, and understand that the learning needs to build up over time in order to help them with their health literacy, correct?
Yeah, that also helps the patient put all the little pieces together,
mm-hmm.
because if you're talking about behaviors and you're talking about medications and you're talking about symptoms, it helps to keep processing it in different ways so that it all makes sense by the time they go home from the hospital.
Yeah, cool. Okay, very good. And I'll also put links in the show notes to the other episodes where we talked about health literacy, because we dealt with it a little differently each time. In one, we just talked about health literacy, and the other one, we talked about the difference between health literacy and functional health literacy, and there is a big difference in the way that you look at it, which makes a lot of sense, where one is knowing it and the other is being able to deal with it and take care of yourself. And then most recently we did one on evaluating patient understanding, which was a good episode. and that was episode 32. I'll put all that stuff in the show notes. So why don't you tell folks where they can find you online?
Well, I have a blog at www.notimetoteach.com, and I'm on Twitter at notimetoteach.
Exactly. And you're also on other social networks out there, but those are your two primary ones. I want to let folks know your book is available wherever books are sold in paper and ebook form. And for those that want to do group, what am I looking for? In-service training and education, you can get a sizable discount by contacting Fran's publisher, Pritchett and Hull. Their web address is p-h.com, and I think you save 40% on a bulk purchase. And then if you're interested in adding video and video on demand into your hospital education tools, you can reach out to us at synergybroadcast.com, or you can Google our video on demand system. We call it MMDS, or Medical Media Delivery System. And you can also find us on Facebook and Twitter and Google Plus and lots of other places. So, Fran, thanks so much for your time and attention today, and I look forward to speaking with you next time.
Bye, Chuck.
Bye-bye.